Let's talk about safety considerations in doula work. Everyone, including doulas, has the right to refuse work that doesn't feel safe for any reason at all. And your own personal safety is first and foremost. Just like when you're on an airplane and they say, if the oxygen masks drop, put your own mask on first. We can't take care of other people if we're not safe and healthy. So look at what kind of environment you're going into. Whether it's the hospital, maybe you're going to choose your parking wisely. Or if you're going to a client's home, consider the area. Is there any domestic abuse? Are there any hazards? Make sure someone knows where you're going. Which hospital are you working in? Maybe, I know with birth doulas, it's hard to say when you might be home. Postpartum doulas have a little more accuracy with that. But it's a good idea that someone knows where you are. If you have any sensitivities or allergies, you need to consider that as well. If you're highly allergic to cigarette smoke or dogs, you're going to have to choose where you work. Maybe you're not going to be able to go into someone's home. If you work in a hospital and you're allergic to the nitrous oxide gas, then that would be something to consider and plan for as well. With this kind of work, you'll need to use universal precautions. Universal precautions are a set of practices to prevent transmission of any kind of pathogens in human body fluids. Basically, we're protecting ourselves and our client from each other's fluids and, any illnesses that might be in there. Of course, hepatitis and AIDS are the two most well-known of those. Those are probably the ones that are the reason universal precautions came about. Universal precautions includes hand washing, use of barriers. Barriers are masks and gloves, how to clean up an area, and what to do with sharps. So if you're working in a hospital, they take care of all that. But if you're working in a home and maybe someone has diabetes and there might be needles around, then you need to know how to dispose of those properly. Anyone with something like diabetes would have some kind of a system in place. The universal precautions protect you and your client. So once you know you're safe, then consider client safety and washing our hands as soon as we go into someone's home or the hospital room. Making sure we don't go to work if we're sick, if we have something that they might get sick from. If you or your client are using essential oils, then you need to know first aid for essential oils because some oils are strong enough to burn skin if they get spilled. So the first aid for essential oils is actually to put something fat on the burn or on the spot where the oil landed. That might be butter or coconut oil, olive oil, milk if there's nothing else. What that does is that dilutes the oil, and then you can use soap and water to wash it off. If your client's taking any medications, doulas are not allowed to give medications. So they need to do that themselves. It's okay for us to bring them the medications, but it's not okay for us to administer them. And it's also not our job to be in control of their medications. If you're working at a birth or in someone's home postpartum and they say, I have diabetes, can you make sure I take my meds on schedule? That is actually not a doula's job. If we're working in a client's home, we really should know infant and adult CPR and choking. We should have the number for poison control handy in our phone. And we should probably know what to do with any chemicals we might come into contact with. If you're using harsh cleaning chemicals, then it's not a bad idea to get some WHIMIS training. That's WHIMIS, or any kind of OSHA training, occupational safety and health training, for whatever you might encounter. If you're cleaning surfaces, especially if there's blood or feces, then you'll need to wear gloves. Also, some of the chemicals are harsh and you should be wearing gloves for that anyway. So use your gloves and clean. Sometimes people just use bleach. Bleach can burn. You need to use it diluted. And you can learn more about that with some of these WHMIS and OSHA trainings. Those are the main safety considerations for doula work. You might find others depending on where you're working. So just remember, keep yourself safe, then keep your clients safe. In your course manual, there's detailed information about universal precautions. And of course, you can get in touch with us if you have more questions about this topic. So I wish you safe and happy and healthy doula work.